Yes, my people, today we are here. It's a good Tuesday. Back to school. Children in Kenya are going back to school. They have been having a very long holiday. Holiday that has been very long. Mhm. Yes, yes, yes. Now, today we will not discuss things as we usually discuss. There is something that I want us to discuss, like a case study for what do we call? It's like a case study for mental health, mental health question. Something like, let me post this. Marje, welcome, welcome, Marje. I want you to look at what I'm posting. Yes, you see that? 28-year-old, gender is female, occupation is a primary teacher, marital status single, presenting complaint is present of mental health clinic within 3 months. Now, I will read this question so that as we discuss these situations, we can at least go on and know what we can do. Now, let's hear this. Let's hear this. Present to the mental, let's say Jen present to the mental health clinic with 3 months history of persistent low mood, lack of interest in activity, difficulty in concentrating at work, poor appetite. Jen is a teacher, has all these symptoms, poor sleep and reduced appetite. She also reports feeling of hopelessness and occasional thoughts that life is not worth it. Yeah, this is a teacher, a 28-year-old. MA, I'm just using something to call this person. Is a synomy, or which is I can call this person Jane. The presenting complaints is this is a discussion. So if you are watching, you may at least come on and help us to learn and understand some situation. So this is a question of mental health. You get it? We have a person C who has these problems. 3 months history of low mood. Low mood meaning she is not, or she doesn't like talking when at work. She's always having difficulties sitting around people. You get it? And at times you can talk to this person, and at times and this person don't listen to you, because have you ever talked to a person, this person is near you but you're talking to this person but he's not responding? Yes, this is our Jane. Lack of mood, lack of interest, lack of no interest in activity, no interest in any activity. At times, some activities when you do them at work, for those who are employed or having working together with other people, when you are employed working together, the team spirit, sometimes you may find that one person is not having this team spirit, and you see, you will come and find out that our person Jane has a problem. And then poor sleep. At times, she doesn't have sleep. She doesn't have sleep and reduced appetite. She also reports on of feeling hopelessness in life, and occasional thought that life is not worth it. Hmm? Let's see. What is the problem here? What is the problem with our Jane, who is 28 years old, female, occupation is a primary year old school teacher, and is single, is not married, maybe. Let's see. Symptoms started when they broke up with the fiancé. Hmm? They broke up with the fiancé, and then the symptoms started. Initially tried to cope by keeping busy, but concentration at work dropped, you see, leading to poor performance at work. Relationship issues. You call it history of presenting illness. How did it start? This is a mental health thing that is disturbing most people who are young at the age of getting into relationships and settling in life. Initially, it started by coping, cope by she tried to keep herself busy. Eh? Concentration at work dropped, leading to poor performance at work. Reports social withdrawal and no longer enjoys teaching or meeting friends. At times, you see, when you are in a relationship, there is that thing that comes in. Eh? You want to enjoy your guy, you want to enjoy your person, you want to enjoy something. And by enjoying, you are discussing and telling your friend how your relationship is going, your best friend, how you want to go somewhere with your person, how you want, you understand, teenage life, those things that come in teenage life, yes, and adulthood, early adulthood. You cannot just be enjoying with your guy and your girl and you are not showing others the experience. Love is experience, man. You should enjoy and feel, let the others feel that you are enjoying. Your friends, eh? When there is a problem, your friends will come and help you. So this one, this our Jane here, reports of social withdrawal and no longer enjoys teaching and meets friends. You know, when things are going on right in life, you will enjoy doing what you like, you do always as an occupation. But when things are not going right, you will be distracted. Eh? But you see, here our Jane is not using any substance, no alcohol, no drugs, no anything. You get it? So our Jane is a straight person. Our 28-year-old lady who is a primary teacher who broke up with the fiancé is not a person who takes a substance. You get it? No previous psych here. She has never been psych. But remember, let's go back to the presenting complaint. Our presenting complaint comes in like this: 3 months of persistent low mood, lack of interest in activity, difficulty in concentrating at work, poor sleep and reduced appetite. Poor sleep and reduced appetite. She reports of feeling hopelessness and occasional thoughts that life is not worth it. Symptoms, this is how the symptoms started. They started after breakup with fiancé. Initially tried to cope, to distract herself by keeping busy at work, but it dropped, you see, leading to poor performance at work. No substance abuse, no previous history of psych, family history, family history. Remember, there are some things that we should talk about when it comes to family history. These psychiatric issues, when you see them in a family, as a doctor or a person who is having someone with depression, always look back at the family, look back at the family life. You know, you remember we talked about in a video somewhere about dopamine, serotonin and epinephrine, those neurotransmitters of the brain. So it may be a problem in some families because there can be a dislocation or something, or a genetic mutation in the brain that does not allow serotonin to come fully, or dopamine, the pleasure hormone, to be reduced. You get it? So it is very important to look at the family history. If you look at the family history, our case study will see that maybe the mother had depression, and it is brought by imbalance of the neurotransmitters in the bloodline in their family. You get it? So when as we talk, we know that maybe family of Gen X had this problem. Let's say the mental state examination of Gen, appearance dishevelled, poor eye contact. Our Gen cannot look at you in the eye. Mood subjectively sad. If you look at Gen, you will see someone who is very sad and low mood. Thoughts, no delusion, no hallucination, persistent suicidal ideation presented. You see, now our patient here is our patient has no delusions, has no hallucinations, has perceived suicidal ideation. Hmm? If you find someone who has no hallucinations and delusions, These ones, you will not put them as a psychiatric. He's not, she is not psych. So our Jane is not psych. Cognitive orders. Jane is lacking concentration. She can't concentrate. Inside, good. Acknowledges, she helps. You see, she's okay. But now, we as per what we have learned here about our patient X, who is Jane, about what we have gone through. Let's go through. The chief complaint is 3 months of persistent mood disorders, lack of interest in activity, difficulty in concentrating at work, poor sleep and reduced appetite. Poor sleep and reduced appetite. And then you see presenting illness, symptoms started after breakup. You see how things are going. This person does not take alcohol, but in family history, the mother had depression. You get it? Now, when you look at those things, we go down and look here. He's not having hallucination. She's not delusional. So hallucinations are brought by imbalance of neurotransmitters in the brain secondary to a disturbance. This one makes you be psych. You see, some disturbance of some brain neurotransmitters. You see, when it is different, when you're having a depressive mood disorder and a psychiatric disorder, there is a difference. A depressive disorder is secondary to an action that started or something that is on continuing that is stressing you. But psychiatric mood disorder, this one is a disturbance of the brain, either physical disturbance or chemical disturbance, which can be a neurotransmitter or something else. Now, if we look at this, whatever we have gone through, we will say that our patient X, who is Jane has major depressive disorder, moderate episode without psychotic feature. That is our diagnosis. We will place Jane at major depressive disorder, moderate episode. Why? Because she doesn't have hallucinations and she's not delusional. If you have a question, anyone, please put it. I want to post the whole. This is a method with 3 months history of. I want to post the whole question. Yeah, 3 months history. 3 months of. Yeah, yeah, here. Yes, you see, I want us to differentiate between psychiatric disorders, and something called, I want to differentiate between psychiatric disorder and something called mood disorders, depressive disorders. I want to, one is, I'm always getting calls when I'm live. Let me, when I'm live, I'm always getting calls. Yes, now we continue and say that our patient X, Jane, is having a major depressive mood disorder because one, this started, the main thing that started was Jane was in a relationship. Jane is not married, and then Jane, they had issues with the fiance, and everything started there. She gave herself to work to distract herself, but it kept on going on, and it led to breakup. Sometimes breakups are painful. Sometimes breakups are painful. We don't need sometimes breakups, but issues concerning relationships give some people good proceedings and outcomes, and sometimes they become so bad at times. Now, you will find some people don't know how to cope with relationship issues. This is a case of a relationship issue that led to a depressive mood disorder. When you laugh too much, today we are talking about major depressive disorder in a secondary to a breakup in a relationship. When you laugh too much and then things are not working, what do you do to move on or to balance things? Because love and relationships are two things that are very complicated. You will find that some people are bank in a relationship, and the other person always promises on the banking on the relationship, like we will do A, B, C, D, and I'll insist to do A, B, C, D. You get it? Whatever that is in a relationship that makes people to suffer a lot is those things. Whatever that is in a relationship that makes people to suffer a lot is whatever other people will say. You get it? We get attached to people not because of the people. We get attached to people because of one thing: losing the person and what the other people will say, or losing the person and what was promised will not be there, or attachment to the person, thinking that this person is the most handsome or the most beautiful person, that the person that you've never. But when you get to a relationship and you settle, and things are not working, you'll find that this one is not. There are so many people out there that can be compatible to you rather than the one that you are hanging on. The first stage of relationship is a crush. And then after a crush, you start settling in a relationship. Settling is whereby you start having issues in the relationship, and then you start having knowing how to plan things, knowing how to make things happen, knowing how to to patch the cracks that you have in that relationship, the two of you. See, if you'll not have a method to patch and solve the problems that you have, it means that compatibleness is not okay. Relationships are are two-way things. If you love someone, you should not always be telling this person that I want to go. You get it? You should not tell this person I need a breakup. It means you got into that relationship without loving that person. The only thing that kept you in that relationship may be a physical thing or an attachment from a social pressure that you were having, or ideas. Some people get into relationship because of group ideas. You go to a party, you have friends, ladies. You get your friends have good boyfriends, you get one from those boyfriends, and then life starts. And when life starts, a child come in, and then you move in. Now you have not related well after 1 year. There are some things you are seeing that were red lights, but you are ignoring because of social pressure. You get it? So when it goes on and it goes on, and step by step, you realize that everything is not working. The other person now comes bold, tells you, now I want to walk out. Our Jane, this is our Jane now. She has a career, she has settled, everything is okay, but the breakup came. You get it? Now, it is very important to learn things, not even love relationships. It is very important to learn how to have friendship relationships, because you may confuse staying around someone, talking to someone, and always doing things together as a friend. You get it? We should avoid this diagnosis called major depressive disorder, because once you are near a person, this is a person you met in college, at work, or somewhere else, you should read the lines. There are some people that are not attached to anything, but when they are with you, they are good. You get it? There are some people that they don't care. We talked about personalities in another. text somewhere in another video. Now, when you find this kind of people, what do you do? You be friends with them. Yes, you laugh together, you do together, but you find an option of a person, those people that you yourself can be confident by telling your deeper secrets. Let's go back to our question, the question of a heartbroken woman who fell into major depressive disorder. Now, what what led to this? What led to the breakup? You see, we are not given. If you read, she reports of feeling hopelessness, is that it, and suicidal thoughts. As per se, I will say that maybe when they were in college before or they met, everything was okay. But now there are some people that, let's say, they will love, they'll get into a relationship promise, but they still have other things undone. So when they are not done with the other things, they will use you to do the other the things that they want. People get into relationship to use other people. So you, when you get to a relationship with someone, friendship relationship, and this one of our case, which is a love relationship, you should very carefully learn to know what is going on in that relationship. Because if you are being used in a relationship, be sure that relationship will end up in tears, because it is a two-way traffic. I've said when you have issues, the first step is a crash. Everything is okay. You laugh, you go to swimming pools, you go to bathrooms together, you eat together, you tell your friend even the deepest secret that you think is the deepest secret. Then that is like after 1 year, 6 months. Now issues start. Now, when the issues are starting, this is where you know how to work out things. Now, this is now the foundation of that relationship. The foundation now. After second year or the second year, when this person does not like this, you like this. You don't know, you don't want this, but this person wants this. Now, you come into harmony, you know how to solve. This is where you don't say, I want to walk away. Love in relationship, people don't walk away. If there is love, you don't walk away, you sort things up unless it's aggressive. You see, when it comes to aggressiveness, there are some people who have personality disorders that are very aggressive. When they are high or they are having anger, they can fight. But you see, it's very good now at the second phase of the relationship where there is a harmony. uh, I don't like listening to music the whole night. I like listening to music the whole night. Hmm? You come to harmony, you think about the other person, you feel like, you like music, I don't like this music, so what can we do? You sacrifice for me a time, and I sacrifice for you a time. You get it? Now there are some things in relationship, like you like going out with your friends. I'm your wife, I'm in the house, I don't like that, but these are my friends. You get it? How can I not go? Even my dad used to go out with the friends, and my mother was is no. Your mother is not my husband, or your husband is not your dad is not my. You get it? This is a relationship. Now you see, this is the second phase where now you have tried to hold on. Your person is going on at night with the people. You come home the first time, you are easy. You don't want to hurt your person by telling him you don't go out with your friend. But now you come the second phase, now it's you. You're telling him no, you should not. If you continue like that, I will go away from this house. You get it? If you continue like that, I will go away from this house. Now, solving issues in a relationship is very important. Sorting and solving issues in relationship. This is where you need to sit down, devise a way. And you know what happens is most issues that come in relationships, one is jealousy, and two is the things that come out of the jealous. This person has gone out with the friends, comes drunk, or comes talking about a friend who is a lady, what this lady did. This is a man. You see, it will bring issues in that relationship. And things will end up bad. Now, our lady, who is a primary teacher here, sadly, they broke up. They broke up. We don't know what led to the breakup, but now she has major depressive disorder. What can lead to major depressive disorder? You see, there are some things that maybe can lead to the major depressive disorder, like as we talk, if anyone has a question, you ask, or if you can add something, it is important you comment. You add and comment something in the proceedings. Now, you see, maybe our lady was having more, was hopeful in life that the career is growing. This man, they will have a family. They will, maybe they have rented a room or house, or they thought it will lead to buying a property. There are so many things. You get it? This one is just one. There are some things like maybe the person who broke up with this was the confidant. And the confidant knows more of secret about this, the secretive life of this person. And the person is, this person, Jane, is afraid that wherever this person is going, it may spread. You get it? There are so many things that can lead to major depressive disorder. If you are not attached to something, that thing cannot hit you hard. But if you are attached to something, that thing can really hit you hard. So, whatever leads to depressive disorder is the attachments that you have towards what you have lost. But you see, in a relationship, breakups are is not a loss. Breakups is not a loss. Sometimes breakup is a win because you may be attached to something that is really slowing your life or really giving you stress because of what you think is the right thing. You get it? So I think we it is major depressive disorder. It depends with the person and what the person is undergoing. Jane has no children. You imagine the breakup will come up with children, that these children are used to the dad. And now they are asking you, where is our dad? You get it? This is a great attachment. So that's why I'm saying living with a person for so long or having a person in a relationship, and you've decided that this person is my girlfriend or my boyfriend, is you should know how to work out things. Hmm? Don't promise anything if you cannot do it, because love is sacred. Love is sacred, and you see, whatever you do to a person on sacred grounds, it will come back to you. Now, we have seen our diagnosis is a major depressive disorder. Now, we go to how can we help Jen? Because now Jen has lost the power to go to work. Life has no meaning. She has no boyfriend, and we really need Jen to be okay. What can we do? What we can do here is is immediate care. Immediate care plan management, assess risk of self-harm. You should assess Jane about the real thing that is saying of suicidal thing. The life has no meaning. It means those are suicidal thoughts. Ensure a supportive environment. Let this person be around someone. Family involved. Remove harmful objects. Crisis hotline provided. Once a person has said life has no meaning and you really see that this person is depressed, always make sure that this person is monitored. You get it? There are some drugs that we use. I will go on to the drugs. You remember our drug, our brain, the brain, we started by saying how the brain works. and the neurotransmitters, how they present. Now we will give like start on selective reuptake inhibitors like fluoxetine. Fluoxetine, they make your serotonin in the brain to be high, so that what can happen? So that the reuptake is stopped and the mood will come again. Monitor the GI effects, the stomach problems, because sometimes anxiety can come in and then you get what? You get, when anxiety comes in, what do you get? You get acidity. You see, insomnia, upset, you can't sleep. If poor response after if these symptoms goes to 6 to 8 weeks, consider dose adjustment or alternative antidepressants. You get it? Psychological, pharmacological management, cognitive behavior therapy to challenge thoughts and improve coping. You get it? Supportive counseling, encourage expression of feeling, provide problem solving solutions. It started when she lost someone. It started when she lost someone. So if breakup is there, can they get back together? What can we do? Can you get someone else? If you cannot get back together, what is the option? What happened to their breakup? Why? There are two options. What happened? What led to the breakup? Can they get back together? Two, what happened? Why are you so depressed of losing this person? Hmm? What is making you? And the underlined what is making you so depressed? You see, there are some things that happen after a relationship that you should check, and they are so important. And they are so important. Why? Because if there is a breakup and you are depressed, it means there is something that is making you be depressed. So, what is that is making you be depressed? What can we help to make sure that you are not going to think and think? If it is a secret you told this person, how can we handle it so that you are at ease? Because if this is the most beautiful person you've ever met, there are so many beautiful people out there. How can we find some other beautiful person or handsome person out there? You get it? Now, these are the things that ends up to a person to get major depressive disorder, like our teacher here. Yeah. Hmm? Psychoeducation, educate about depression, treatment, adherence, and relapse prevention. The first important thing when it comes to healing of something is to move on. But if you find you are moving on and you are so bitter about it, you have not yet moved on. You are still having a problem. You get it? Yes. You're still having an issue that is pending that you really need to work on. Now, social support and lifestyle. Encourage regular physical activity, balanced diet, and sleep hygiene. Reconnect with family, trust friends or social support. Workplace, recommend temporary light workload and medical leave. Now, is medical leave, this is about social support. This person, when he's on leave, he should not be alone. Family and friends, follow up, always continue medication for 6 months. That is our case today. And these are cases because we started with what is called we started with what is called um, mental health. These are the questions that I'll be posting so that we jump our brain about normal issues that occur in some areas of mental health. You see, they are depressive because this one it started after breakup and the person is like losing hope in life. And if the person is losing hope in life, you see, we should come in and help. So that was the topic of a quick question of the day today. So our 28-year-old female primary teacher marital status is single after breakup. Uh, the problem was major depressive disorder, and we have seen how we can manage major depressive disorder. And if these cases, people avoid these cases so much. Sometimes when a person talks about breakup and relationship issues, people don't want to listen because it is a very painful situation at times, and people have undergone these situations. And when people have undergone these situations, they moved on in their way. Everyone has a way of moving on with whatever that she is undergoing. So you will find that the way you moved on with with your problem is not the way that someone else will move on with his or her problem. You see, so we should assist each other when it comes to depression, because there are some things that are in life that very important people lose their importance because of very slight small issues. So we learn how to help each other by talking to each other. If you have learned something and you think the best, please. Today we have a very short question. Yes. If you've learned something today, just say like and share the button, and everything will be fine. We have talked about major depressive disorder and psychotic disorder, and it was a case study. Our case study is saying that this person at mental health state examination, the appearance was deceived, poor eyesight, subjective sad, objective mood low. Thoughts of this person, of the Jane of our Jane, she was no delusion, no hallucination, passive suicidal ideation. Yes, passive. You remember she said that life has no meaning. That is passive ideation, suicidal ideation. And then we have cognition of a minute. And then we have cognition mild difficulty in concentrating. Inside good. You see, so we have dealt with our person, we have treated her, we want to find a solution for her. Maybe, even maybe finding a solution of another person to her is not a solution. You see, you should find out why a person gets depressed after a case. You get it? So this is very important, and it was a very short case study. Tomorrow we'll have this week is a week of case studies. Case studies. We want to see how we can help, and then the other week we continue with our lessons as we go on. Thank you so much. If let me give some let me give some time if anyone has a question to ask. If anyone has a question to ask. Before I log off. Anyone has a question? No question. Bye. See you another day.